Hello, my beautiful nurses. This is Sanitha Abin Abraham, registered nurse, signing in today with some basic ECG interpretation. And I'm pretty sure I made it very simple for you to understand and digest. So, before we talk about the actual step, let's learn few important concepts that will help us have better understanding of what's going on inside the heart and how it generates a heartbeat. So the first concept that we are going to discuss is the conductive system of the heart. Now the conductive system of the heart start like this. There are some cardiac cells are responsible in conducting signals, that is SA node and AV node. And you can see these cells right here. This is sinoatrial node and this one which is called atrioventricular node or AV node. And these cells are responsible in producing or conducting signals that cause the heart to contract. And this sinoatrial node that you can see right here in the right atrium, this is also known as natural pacemaker of the heart because this is from where the contraction begins. That is the reason we call sinoatrial node natural pacemaker of the heart. From the SA node, the conduction goes to the AV node. We also call this AV node gatekeeper of the heart. The reason why we call this gatekeeper, same like this name, the AV node only decide what impulse that I have to let go through. Sometimes SA node produces weak pulse, or if there is any blockage in the atrium, the AV node won't allow the impulse to go through this. Instead of that, AV node itself produce its own impulses on pulse from the AV node. The impulses pass through a single structure right here called bundle of His, and from the bundle of His, the cells will continue and bifurcate or separate into two different cells that is called Purkinje fibers that is found in the left and right side of the heart, and they are extended till the apex of the heart. So let's do the quick revision again. The conductive system of the heart start from the SA node, then it goes to the AV node, next to the bundle of His, right and to the left bundle branches of the Purkinje fibers, then it eventually go to the apex of the heart. The second important thing or concept we need to know is inherent rate. Inherent rate means the cardiac cells, they can produce their own impulse. So as I told, we have different cardiac cells here, SA node, atrioventricular node, bundle of His, Purkinje fibers. And you also know SA node is the place node where the contraction starts and the impulse go from bundle of His towards the Purkinje fibers and to the apex of the heart. So the SA node can create 60 to 100 impulse beat per minute. In case if there is any failure, if there is any problem in the SA node, if the SA node is not able to produce the impulse, then the AV node and the bundle of His, they produce their own impulse. So the AV node and the bundle of His can produce up to 40 to 60 beats per minute. If the AV node and the bundle of His fail to produce the impulse, then the third smart people come into act, that is bundle of branches and Purkinje fibers. So the bundle of branches and the Purkinje fibers can create up to 20 to 40 beats per minute of impulse. So that is all about the inherent rate that I wanted to say. Now let's discuss about ECG. ECG have different parts. So it has P, Q, R, S, T. If you see a small bump right here, that you can see here is called P, and this is QRS, and again you find a small bump, that is T wave. Let's start up with the P wave. So I have written here, P wave represents atrial depolarization. So you already know it, atrial contraction. So when the P wave is there, you just need to understand both right and left atrium is contracting. That is the reason we are getting a P wave right here, the small bump. Next, you can see the QRS. So the QRX complex, which represents the ventricular depolarization. When you see this QRS, you need to understand it is also looking like a V. So QRS is ventricular depolarization when the both right and the left ventricular is contracting. And again the T wave. So the T wave is nothing but the ventricular repolarization when the ventricle relax after contraction. So that is the bump again you see here. So P is for atrial depolarization, that is when right and left atrium contract, and when the ventricle contract, you get this QRS complex. When the ventricle is relaxing, you get this T wave. You might be thinking that then where is the atrial repolarization? That can be found within the QRS only, that you cannot see here, and that is not even important. Now let's talk about the segment and intervals in the ECG diagram. Actually, this is little bit complicated. So let's make it a little more simple and learn only basics for you. So to interpret a basic ECG, you just need to know about PR intervals and QRS complex. So just to make a note of it, and we will find an ECG strip, normal ECG strip like this, a plain ECG strips, and you will find small boxes in it. So I have mapped here. You can see a big column, and inside this column you will find small boxes. I'll show you more closely. So as we have already seen in the previous slide, here I have made a close view. So you can see the big column. So actually this big column have 5 small boxes. The big boxes have small boxes. So as we already seen in the previous slide, a big box, and inside the big box you will find 5 small boxes. Each box is equal to 0.4 second. So as I already told you, you have seen already 5 boxes inside the big box. So we have to multiply it 0.04 second into 5, that is 20 second. So each big box is equal to 20 second. So let's learn some basic interpretation of ECG. First step, we are going to identify and examine the P wave. Second step, measure the PR intervals. And third step, we are going to measure the QRS complex. Fourth step, identifying the rhythm. Fifth step we are going to learn is determining the heart rate. So let's see one by one.
The first step is identifying
A normal P
and
wave would be
examine
present,
the P wave.
and if the P wave is there, it's quite normal, and if the P wave is absent, that you can see in this ECG picture, there is no P wave that you can find. This is the form of dysarrhythmia. Dysarrhythmia means abnormal or irregular heartbeat. So absence of P wave indicates abnormal or irregular heartbeat. Second step, we are going to measuring the PR intervals. This we measure from where the P wave starts and from where the QRS complex starts, that we marked already. What we do is we count the number of small boxes, that is 1, 2, 3, 4, 5 in between, and multiply it with 0.04 second. So I already told one box is 0.4 second. So when we multiply it 5, you get the number. The normal number, the magic number of PR interval is 0. It should fall in between 0.12 second to 0.20 second. That is the normal value. But if it is more than this, that means there is a problem with the ECG. So let's see here. We have 1, 2, 3, 4, 5 boxes. So 5 into 0.04. So it is falling again 0.20 second only. So it is a normal this thing. So more than 20 indicates another dysarrhythmia such as heart block. Now let's see the third step, measuring the QRS interval. In this QRS interval, as we have seen in the PR interval, we are going to count the boxes only. The magical number for this QRS interval counting, we have to know the normal interval rate. That is 0.6 to 0.12 second is the magical number that we have here. So more than 0.12 indicates a dysarrhythmia such as PVC. PVC means premature ventricular contraction. So now let's see the fourth step, identifying the rhythm. From our strip, it can be seen whether it is regular or irregular. The way we do this is we measure the distance between the R's from here to here. We can do this by index card method. First we mark your two R's and match them with the other R's. If they are same distance, it's regular, otherwise it is irregular. Now the last step that we are going to do is calculating the heartbeat. So there are so many methods that people use to calculate the heartbeat, but here we are using the simplest method, that is counting the boxes. So the big boxes that we have here, that we have to count between two R's. So this R starts from here, so you have to count from here 1, 2, 3, 4, 5 boxes. From the 1 to the another R's, we can find 5 boxes. So that 5 boxes we will divide it with 300. So when we divide with 300, you get the exact heartbeat of that particular patient. So here we got 5. So I have divided it with 300. So the beats per minute that we got here is 60. I guess you got it. So that's all about the basic ECG interpretation.
I hope you must have learned something from this video and it might have helped you. If you really liked my video, you can like, share and subscribe. Thank you so much for watching. Bye bye and catch you later.